Kate Spade's sister says she may have taken her own life because of a struggle with mental illness. Spade was found dead yesterday in her New York apartment. Spade's sister suspects the designer may have suffered from bipolar disorder and tried numerous times to get help. Mental health are issues that affect a lot of people of all ages around the country, and Dr. Manther Barakat, a clinical psychologist from Aurora Healthcare, is here to explain how people can get help. Thank you so much for joining us today.
Thank you for having me.
Dr. Barakat, talk about how frequently you see patients who are struggling with suicidal thoughts.
Well, I see them relatively frequently based on the level of care that I work at. It's a little bit higher level of care than the traditional outpatient setting, so I do see a significant amount of patients who have experienced suicidal ideations.
And, I know you can't go into detail, but what are some of the things that you do right away when you're dealing with those patients?
Well, we monitor where they're at. I mean, if they're expressing constant suicidal ideations and they have attempts in the past and they look like they're not stable, we might refer them to a higher level of care where medication needs to be adjusted or they need to be stabilized in that manner. Then we make appropriate referrals in a sense to try to get them stabilized and get them at a level where they can function in a regular traditional outpatient setting.
Talk about, in your experience, what can drive someone to have suicidal thoughts?
Right. Well, research shows that a big trigger is loss. It could be loss through death. It could be loss through divorce. It could even be a significant loss in how we view ourselves and our self-concept, our job, or something of that nature as well.
And, these suicidal thoughts and things like this, they don't impact one group. This can happen to anybody.
It can happen to anybody. It doesn't matter the age. There's a myth out there that doesn't happen often with children, but actually does happen significantly with children and adolescents as well. So it does affect everybody. It doesn't matter their culture, race, or whatever. It affects everybody.
And so should parents or relatives of someone who's been having mental health issues just be on the lookout for suicidal thoughts?
Right, look out for suicidal thoughts and any other warning signs. It could be isolative behaviors, lack of much too as well could be a warning sign. Drug and alcohol use is a big warning sign as well. So look for these things and a significant personality change as well.
And talk about what a parent or family member should do right away if they experience a loved one who's having these issues.
Well, bring up these symptoms to your doctor. I mean, people have easy access to their regular physician, and they're trained to make the appropriate referrals when needed. And they'll make a referral to either a mental health facility or a psych hospital where they can get assessed for suicidal ideations and the level of care they might need.
And quickly, what is Aurora doing to try to help more people who are struggling with this?
Well, we're constantly developing our way to assess patients and make sure that we're using evidence-based treatment and we're doing appropriate things to make sure that we're constantly on the cutting edge of looking at these things. So,
Dr. Barakat, thank you so much for joining us. And if you need more information about this, there's information on our website, CBS58.com. Thank you so much.
Thank you.
Mike, Rebecca?